Since 1971, the Kansas Hospital Association has recognized individuals who demonstrate distinguished service and outstanding contributions to the field of healthcare in Kansas with the Charles S. Billings Award. Richard P. Miller, the 35th recipient of this award, has certainly demonstrated these qualities during his devoted healthcare career of 42 years. Rich is the oldest son of Oliva and Marcel Miller, who stressed the importance of education to Rich and his three younger brothers, Tom, Frank, and Alan. Education was emphasized, as their parents only had the opportunity to go to school through the 8th grade. Rich was born in Hays, Kansas. When he was 6 years old, his family moved to Norton to farm. Rich attended Norton Elementary and was involved in 4-H, vocational agriculture, and Future Farmers of America. The town of Norton was noted for wrestling, and Rich was part of the 1962 State High School Championship wrestling team. He graduated from Norton Community High School in 1963. Rich studied at Fort Hays State University, receiving his bachelor's degree in political science in 1967 and his master's degree in business administration in 1971. Rich served in the United States Army from 1967 to 1969. He spent most of those 2 years in Korea during the Vietnam War. Rich began his healthcare career in 1971 as the assistant administrator at the Norton County Hospital. In 1975, Rich married Tammy, who had been one of his classmates at Norton Community High School. They have 3 children, Michelle, Todd, and Aaron. One of Rich's early accomplishments at Norton County Hospital was bringing in a licensed practical nursing program that was offered by Colby Community College. This had a positive impact on not only the hospital, but the numerous nursing students who would otherwise not have had this kind of opportunity. Rich became the administrator and chief executive officer at Norton County Hospital in 1980, making him one of the longest tenured hospital CEOs in the state. Over the years, Rich has maintained a determined focus for making quality health care available in Norton and is constantly looking for ways to continue this quest. Rich has been instrumental in numerous successful expansion and remodeling projects, which allowed the hospital to expand services and evolve as the healthcare landscape changed. His diligence in providing a modern facility and up-to-date medical equipment has been essential. This commitment helped Rich attract a very strong medical staff as well as a support staff to Norton. One of the highlights of his career is the recent renovation to the nursing school, done in conjunction with the Norton County Economic Development Division and Colby Community College. Rich's commitment and dedication to healthcare reaches far beyond the hospital setting. He has established himself as a leader to his peers and is always quick to help in any capacity. Rich has served on the board of directors for the High Plains Mental Health Center in Hays for several years. He has served as past chairman of the Association of Continuing Education in Central Kansas. He is also a past board member for the Blue Cross and Blue Shield of Kansas Hospital Advisory Board, making sure small hospitals had a voice in the healthcare market. Rich also served on the advisory board of the Kansas Foundation for Medical Care and the High Plains Medical Information Network. In 1988, Rich was one of the original founders of MedOp, a group purchasing and networking organization in Northwest Kansas. Rich continues to serve on the MedOp board, which today operates over 15 hospitals. For years, Rich has made sure local, state, and national legislators knew the difficulties of rural hospitals, as well as helping them understand the complex nature of healthcare. He has served as a voice for rural hospitals not only in his community, but in Topeka and Washington, D.C. as well. Rich has served the Kansas Hospital Association in many capacities throughout his career. He has been instrumental in providing leadership to KHA by serving on nearly every policy council KHA has ever established, as well as many of our special task forces and committees. Rich served on the KHA Board of Directors from 1996 to 2002. He also has served as chairman of the KHA Northwest District and chairman of the Kansas Hospital Education and Research Foundation Board. Rich demonstrates the importance of all KHA has to offer by encouraging department supervisors at Norton County Hospital to also join their respective organizations. He continues his commitment to the Kansas Hospital Association by currently serving on the KHA Council on Policy and Advocacy and agreeing to serve as chairman for the Northwest District next year. Beyond his service to hospitals and healthcare, Rich is also active in his community. As a veteran, he is very involved with the local American Legion and has been the finance officer for this group as well as the local American Legion baseball team. For many years, he enjoyed coaching American Legion baseball as well. In addition, Rich is a dedicated member of the St. Francis of Assisi Catholic Church, the Knights of Columbus, and the local Lions Club. He also donates much of his free time helping deliver for the Meals on Wheels program. Throughout his remarkable career of service to the Norton County Hospital and KHA, Rich has seen incredible changes to the healthcare system. And while those changes have been unsettling and even threatening, Rich has consistently provided calm, common-sense leadership. Most importantly, Rich is dedicated to his friends and family. When he's not working on making healthcare stronger in his community, you can almost certainly find him helping his son on the farm, attending the grandchildren's events, or spending time with his wife, Tammy. When you consider everything Rich has given to KHA and the hospitals of Kansas, it is quite simply impossible to think of anyone more deserving of this honor. The Kansas Hospital Association would like to congratulate Rich Miller, the 35th recipient of the Charles S. Billings Award. Thank you, Rich, for your distinguished service and the unforgettable mark you have left on healthcare in Kansas.